Hey guys, and welcome back. Eric Wood-Salomon here from Physio Fitness Cambridge, CrossFit Rebuild, and the Shoulder Clinic Part 2. I'm focusing this segment of videos on impingement syndrome. This is the most common cause of shoulder pain. Represents about 60% to 63% of all shoulder pain issues. Basically what happens is some of the muscles deep in the shoulder get pinched between your humerus, which is your arm bone, and your acromion, which is the bony shelf at the top of your shoulder joint. So this is my humerus, here's my acromion, and that space between there would be my rotator cuff. With poor posture and position, like a tipped forward shoulder, that's going to get pinched up and cause pain. When it gets really bad, some patients will complain of even pain down the arm into the hand. It's originating from the shoulder. This is a mechanical type pain, which means that certain positions and movements don't cause pain, and certain positions and movements do cause pain. Typically, reaching out is painful, reaching up hurts, reaching back to get something in the car. What's happening, especially with reaching behind you, you notice my shoulder is dumping forward, which is jamming up the rotator cuff. So we're going to go over a simple exercise today to help build better posture and stability. So the trick to maintaining a healthy shoulder is keeping your shoulders active. Most of this stuff is caused by repeated movements or positions. So the thing to remember about posture is it's a habit. You're not born with bad posture. Okay, so if I'm going to be at a computer for 8 hours a day and then driving for 2 hours a day and then texting for the remaining time, my shoulders are going to be destroyed because I'm just hanging off of them. What we need to do is activate the musculature between the shoulder blades, get our shoulders up and back. In this position, my middle finger will be at the seam in my pants. Okay? So always be thinking about, what position am I in? Catch yourself when you're slouching, because even just correcting your posture will make a huge difference in your quality of life. You want a better life, you need to make better choices. You need better posture. You have to decide, I'm going to have better posture. So the simple exercise we're going over today is called a scapular retraction. Scapula is your shoulder blade. We're going to be retracting it against gravity. We'll be doing 10 repetitions with a 5-second hold to start. So I'll show you what this is going to look like. So I'm going to lay down facing down, so I'll focus on my right side with my left forearm under my forehead. So laying down, my forehead is on my forearm, and all I'm going to be doing is extending my elbow and pulling my shoulder blade. I'm pinching it back. I'm going to lift my hand off the ground, hold that for 5 seconds, and then relax. And then again, I'm going to retract my shoulder blade, lock up my elbow, hold that for a 5 count, and then relax. The trick with this, all that movement needs to be coming from the shoulder blade, not your spine. So what I mean is, don't extend your back when you're doing the retraction. All that movement is from the shoulder blade, and then you relax. So you start with 10 reps with a 5-second hold. You're going to build that up to 10 seconds. If you're doing this properly, it'll be quite challenging. The trick with any therapeutic exercise is that it has to be pain-free. So if I'm expecting this to get rid of my shoulder pain, it can't be causing shoulder pain. So give that a go, and we'll see you next time for part 3.